Well, you guys already know Tamer and you know Gabriel, and I'm going to introduce you again to them, those of you who don't. But they have a product that is so dynamic without side effects for pain. How many of us suffer from pain? Listen to the 4 top drugs people take for pain. One of them is actually not a drug at all because you can walk into a pharmacy and get it. It's called aspirin. And then there's acetaminophen, things like Tylenol and so forth. Number 3 is opiate-based, and I mean millions of these products are selling. 16,000 people die a year by taking, just that one opiate-based drug. And then non-steroidal anti-inflammatory, Advil, Aleve, ibuprofen, you've heard of all these things. This is an interesting statistic, I thought. After taking these drugs, NSAIDs, for a period of 60 days or longer, your chances of dying from it are 1 in 1,200. So let's get the facts here on pain from Gabriel and Tamer. Thank you guys for coming in and sharing your thoughts. That, if I'm taking pain medicine, if I'm in pain, I'm worried about side effects. Gabriel?
Yes, and one of the most commonly prescribed medications for joint-related pain is, here's some of the common side effects. The most common side effects are infections of the injection site, infections caused by viruses, fungi, or bacteria, injection site reactions. Those are just the common side effects. Now, some of the serious risk of side effects, risk of infection including tuberculosis, viruses, fungi, or bacteria that spread throughout the body, and some have actually died from these infections. Risk of cancer. So you're taking something so that you feel better, but it kills you. Risk of cancer. This is one thing that was really disturbing to me. Unusual cancers in children and teenage patients who started using this particular medication at less than 18 years of age. Hepatitis B infection, nervous system problems, blood problems. Your body may not make enough of the blood cells that help fight infections or help stop bleeding. Heart failure, psoriasis, autoimmune reactions, including lupus-like syndrome, autoimmune hepatitis. I could go on and on.
I was going to say, if we had 30 minutes, I'd ask you to come in. And by the way, Tamer, that's a drug. I know what drug that is. That's a drug that is commonly prescribed. But very few doctors have the half hour to sit down with their patients and say, look, here are the side effects. Your daughter's 15, I'm starting around this. Along comes a product, along comes a guy named Tamer El-Safi, along comes a product named Flexcin. Tell us a little bit about this, because that's the reason you're sitting there today.
Well, he just mentioned all these side effects, and they were just making me sweat, just listening to them. And that's exactly why I started Flexcin 10 years ago, over 10 years ago, because I didn't want to see my grandmother, she was suffering from those types of side effects. I didn't want to see her suffer anymore, and I thought, there's got to be a natural alternative for pain. And she was taking actually one of those drugs I can't really mention, but and it gave her all these side effects.
But Tamer, today, and Gabriel, today we see chondroitin, glucosamine, a lot of these products on the market, and they're selling wonderfully. You found something, and this is where it gets exciting. You found something in the medical literature called CM8. Can you expound on that a little? What is CM8?
Well, CM8, it's acetylmyrostolia. It's a fatty ester of a fatty acid, and what it does, it's an anti-inflammatory, and it lubricates your joints, and it's all an autoimmune modulator. Okay. So it helps with your immune system, and it's just an all-around. It's much more than glucosamine. Glucosamine is just a small part of our formula, but Flexcin, containing CM8, which is our flagship ingredient, makes it much more powerful. We have, of course, the bromelain and collagen and all that other stuff, but that's why we need to convey to other people that it's just not just a glucosamine product. We're far beyond that.
People have choices, Gabriel, and I talk about diet all the time on this show. So many people have tried the glucosamine chondroitin, have tried the drugs, they're worried about side effects. How long does it take the Flexcin to get in the body and start working?
Typically about 3 to 4 weeks. By the time you're done with the first bottle, you start to feel a positive result. And, Tamer mentioned it's not just a glucosamine. That's a question we get a lot. Is this a glucosamine product? It's a small part of the formula. The acetylmyrostolia sets the stage for the healing to begin, so you do notice that result a lot sooner. Glucosamine alone typically takes 3 to 6 months before you start to see any type of positive effect. So you see it a lot sooner, and it's a lot more effective.
See, I like this building up. Take 3 bottles before you really say, aha, I'm finally out of pain. It often takes that long. By the way, our phones ring all the time, giving us all these wonderful testimonials on your product. Thank you guys so much for being here.
Thank you.
Don't go away, friends. More Know the Cause right around the corner.